Okay, my name is Hoyn. I'm a consultant psychiatrist and editor of Global Psychiatry Archives, and we report on papers we recently published. So this is a paper by Charalambos from Greece, Cyprus, talking about the critical role of body dysmorphic disorder in dermatological patients' body image. Patients' desire to seek even more medical treatments increases after dermatological treatment. That's a bit of paradox anyway. So we come to that and explain it later. So what is the question? So they wanted to investigate whether patients with visible skin disorder or non-visible skin disorder, so that's acne in the face and psoriasis on other parts of the body, whether they affect the perception of well-being after dermatological treatment. Right, and then the question is whether body dysmorphic disorder influences patients' desire. So there are 54 patients with acne, 54 patients with psoriasis or eczema, and 54 patients without any problems. And then they had some assessment before and after the treatment, which in most cases was successful, as far as I understand. Anyway, so what happened then is that patients, and these 54 patients had a different scales. So they had this scale for which is the multidimensional body self-relations questionnaire. So it's a questionnaire which assesses quite a few perception of happiness or unhappiness with different parts of the body. There was sociodemographic questionnaire, a body dysmorphic diagnostic module based on the SCID, and as I said, this multidimensional body self-relations questionnaire. And so this was then assessed before and after, and the study hypothesis were usually if the differences in body image between the group before and after treatment, and this is the case. So patients with acne and psoriasis had more unhappiness or were less happy with their body image than healthy controls. Right, that's understandable. So these are the questions, and interesting, say there is before and after. And what happened here, interestingly, is that the people with the psoriasis, they were more or less unchanged with their happiness about their body image. But what happened, interestingly, is that the people with acne after treatment were more unhappy than before after treatment. So treatment did not improve the evaluation of the appearance of the patients. Interestingly enough, that also the patients with acne, even though it's just facial problem, they had less satisfaction with their body image, even with their height, which has nothing to do with acne, than controls. Anyway, so this is then the face satisfaction before and after. So what you can see here is more or less the psoriasis group and the control group have no changes. Interestingly enough, even though the psoriasis patients had nothing in the face, they were less happy with their faces than controls. And this seems to be that, some problems in some parts of the body seem to affect the whole of the body, or the satisfaction with all of the body parts in the whole of the body, even though height, which has nothing to do with that. Anyway, so this was then overall appearance satisfaction, and that was then reduced in the patient with the acne group even after treatment. So, and the other thing is that people with body dysmorphic disorder, that was one of the hypotheses, they performed worse and they wanted more therapy after the successful theory. therapy. So what happens is, and this is quite unusual, that people who have treatment for acne have more need after successful dermatological treatment, and they have more needs if they have a body dysmorphic disorder. So that's quite unexpected in my view, that the dermatology more or less creates more need for dermatological treatment, even if that's not unsuccessful. And body dysmorphic disorder doesn't help, and that's understandable. And the other thing is, which I think is unusual, is that the unhappiness with body parts which have nothing to do or not affected by the dermatological disorder are involved in a way that people with dermatologic problems generalize their unhappiness with their body to other parts of the body which are not affected. Right, so that's it. And if you want to read the full paper, you're welcome to do that on the website www.globalpsychiatry.co.uk. And if you want to hear or see more of these videos, please subscribe to our YouTube channel. Thanks for your interest, and have a nice day. Bye-bye.